Hi everyone. Today we are going to have an interview with one of our hip replacement surgery patients, and I would like to introduce you to Mr. Jim Dudley, and he is 82 years old from Australia. Hi Jim.
Hi.
How are you?
Very well, thank you.
I'll just have a few questions for you.
Right.
Alright. Okay. First would be, why did you choose to have your surgery overseas instead of doing it in Australia?
Well, there was no waiting time for me. I could more or less get the surgery done straight away, and also to paying for it, it was half the cost of what I would have paid in Australia.
How long were you in pain?
I've been in bad pain now for the past year, but I've had it come in over about 3-year period, but it got so bad that I couldn't sort of go on any longer with it, you know.
Alright. How did you find global health travel and your overall impression during your first contact?
Perfect. They give me good advice and things I must do and mustn't do, and I was very pleased with them. They've got a very good setup to see everything's okay.
Wow. How long did it take before you were able to get an appointment here in Thailand?
I got here on Monday, and I was being interviewed by the doctor on the Tuesday, so it was the next day. And then I was admitted after all the tests to see if I was fit enough to have surgery. I was admitted to have the surgery on the Friday.
Yeah, but since you contacted Global Health Travel, how long did you have to wait for us, to book you in here to have an appointment here in Thailand? Did you wait for a long time?
Oh no, a week.
Yeah, just a week.
Yeah, a week.
All right.
Yeah.
Were you nervous before coming over here?
Very nervous, yes.
So what did your family think about doing your surgery here overseas?
Yeah, they was all for it. They said, no, go and get it done. If it's going to relieve the pain, go for it. They told me straight away. They was all for it, you know.
So when you came here in the hospital for your consultation for the very first time, what was your first impression about the hospital?
Oh, I thought it was wonderful. I'd never seen such a clean and well-run hospital in all my life, you know, and I've been halfway around the world. I've travelled.
And who was your doctor?
Dr.Sitthiporn.
Yeah,
Sitthiporn.
How did you feel after walking out the consultation room after seeing Dr. Sitthiporn?
He put my mind so much at ease. I felt 100%, you know, to go for the surgery. Before that, I wasn't sure whether to have it done or not. But after speaking to him and the way he explained everything, I thought I couldn't lose, you know.
Yeah. So what was your clinical diagnosis after a series of tests done? And was it any different with what was diagnosed to you before coming over here?
No, it was a complete hip replacement that I had to have done.
Okay. So when did you have the procedure done? And can you still remember the series of tests that needs to be performed before you are cleared for surgery?
Yeah. I had the surgery done 5 days ago, and I had to go for x-rays and blood tests and
echocardiogram for your heart?
Heart diagram. But they go through your whole body and check everything out and make sure it's all okay.
Okay. What procedure did you go, and what was the prognosis after surgery?
It was very good. When I came out, they got me up for exercises the next day after the operation, and they was quite pleased on my manoeuvrability, you know.
Wow, yeah. I'm quite impressed too. How did you feel when you woke up, and are you still in pain now?
No, I've got just a slight. When I woke up, I was fine because I was still under medication, I think. And now I've just got a slight pain where the operation took place. But it's nothing like the pain I was in before.
So Is there any big difference with the pain you felt before compared to having it done, after the surgery?
Oh yes, yes.
Is it alleviated?
Yes, 90%, 90%.
That's good to hear. So how much did the procedure cost in total?
The whole surgery procedure come to about 23,000 Australian dollars.
Okay. So the big question is, would you recommend other Australians who are suffering in pain like you did before to travel overseas and jump the queue to have elective surgery?
Definitely. I wouldn't tell them, don't hesitate, go for it.
Yeah, there are lots of Australians who are in a similar situation, who are in long waiting list, who think you're probably crazy traveling to Thailand for hip replacement. But do you have anything that you would like to say to them?
Well, I felt the same way before I came here. I was a bit dubious, and I was a bit worried instead of a new hip I might come back with a set of boobs. That was my only problem, but since I've been here, there's no such occurrence,
Good to know. So do you have any tips or any suggestion for those people?
No, the only thing I can say, if you can afford it, if you can afford the amount, just go for it. Yeah, don't stay in pain like I did. I should have gone for it years ago, instead of suffering.
Okay. How did you find the pre-operative and post-operative care and the assistance provided by Global Health Travel?
Very good. First class. Yeah.
Lastly, would you recommend them?
Oh yes. Number one. Number one.
Good. Thank you so much, Jim, for taking the time to talk to us today. We are so glad that we are able to help you. And hopefully we can help many more Australians in a similar situation. Okay. So in behalf of all the Global Health Travel team, we wish you a speedy recovery.
Thank you.
All right?
Thank you.
I hope we'll see you soon walking without the walker.
Oh yes.
All right? Okay. Goodbye.